Hi, everyone. Thanks for joining in. We are live on Facebook today to talk about men's health. So, June is Men's Health Awareness Month, and this is really a great opportunity for us to hit on some really exciting topics that are commonly seen in our practice. So, now before we begin, let's start with some introductions. I am Dr. Jason Singh. I'm a board certified primary care physician with the Mid Atlantic Permanente group of Kaiser Permanente, and I am joined by my very esteemed colleagues. Let's start with Dr. Lee. Dr. Lee, would you like to introduce yourself?
Hello there, I'm Dr. Lee. I'm a board certified urologist. I graduated medical school from the Medical College of Virginia. I did my training at Harvard, Massachusetts General Hospital. I've been here with Permanente Medicine for 2 years now. I'm based out of Tyson's Corner. I have a special interest in men's health.
Fantastic. Welcome, Dr. Lee. And Dr. Winston.
Thank you, Dr. Singh. Hi, everyone. My name is Dr. Doc Winston. I am a board certified urologist who's been with Permanente Medicine for 7 years. I practice in Capitol Hill and our Largo Medical Center, and I have a special interest in men's health as well as underserved populations. Thanks for having me today.
Absolutely. Thanks for being here, Dr. Winston. And Dr. Okoto, please go ahead and introduce yourself.
Hi, thank you. Hi, my name is Dr. Kwami Okoto. I am a board certified family medicine physician practicing with Permanente Medicine in the Baltimore service area for Kaiser Permanente for the last 13 years. And I'm excited to be here and talk to you about men's health.
Fantastic. Exciting to have you here as well. So let's get started. So why are we talking about men's health? Why is it so important? Well, it's interesting. When you look up the top 10 causes of death by sex, men lead in almost every one of those categories. And so why is that? A large part of that is because guys are just reluctant to see us unless something's wrong. Only 40% of the men go to the doctor when they fear they have a serious medical condition. So let's think about that. Preventive care, routine exams, lab studies are missed, and symptoms when they do develop are minimized or often ignored, which can lead to a delay in medical attention. And that's why it's so important for us to bring awareness to this issue and talk about this today. So let me start with yourself, Dr. Okoto. In your practice, what are some of the common health concerns for men, and are they any different for women?
Absolutely. So thank you for that question. So some of the leading causes of illness and death, as you mentioned, include things like heart disease, which has associated risk factors such as high blood pressure and diabetes, cancer, unintentional injuries, stroke, respiratory illness, kidney disease, and all of these things are also notable in women's health. But the important thing to mention here, as you mentioned, is historically men have disproportionately been affected by this in the United States. In fact, as of 2020, the CDC reports that men have a lifespan 5 years less than women on average, which is really concerning. The good news is that most of these conditions are either preventable or well managed when they're discovered early. So this is why we really encourage men to seek out care. They all have a really significant lifestyle component that we can all tackle together with our support systems, such as our family, our friends, and our healthcare teams.
That's a very staggering number, looking at the life expectancy between genders. Now, I know cardiovascular disease is number one for men. It's a big problem for guys. What do we need to know about that?
Yeah, so there are some risk factors, and generally you can break down cardiovascular disease or heart disease into two groups. There are factors that are controllable, things that we can have impact on through our lifestyle interventions, and then there are factors that are not controllable. So the factors that are controllable are things like high blood pressure, diabetes, obesity and overweight, high cholesterol, smoking, physical inactivity. The factors we cannot control are things like normal aging or genetic history. So first off, what I do recommend is that you go ahead and get screened. Once you're over age 40, your physician actually can use a special calculation to determine your potential cardiac risk going forward. And there are a few things there to assess and address under the guidance of your physician. So you want to try to replace unhealthy foods like processed foods, sugary drinks, so that's anything basically a processed food. I would say anything that you see in a box, a bag, or a can generally. You want to try to have more fresh foods, a variety of fruits and vegetables, high fiber whole grains, beans and legumes, lean meats, and replace those sugary drinks with water. And then you also want to try to eliminate or limit your alcohol intake, which can have an adverse impact on your cardiovascular health. In addition, we recommend that you try to stay active. For the average person, we recommend about 150 minutes a week of moderate activity with 2 days of some resistance exercise as well. And this type of stuff can help improve things like your blood pressure, your sugar, your cholesterol, your bone density, your sleep. We recommend you try to get at least 7 hours or more of sleep as an adult, high quality sleep. So set timers, make sure that you are consistent with when you go to sleep and when you try to get your day started. Do things like try to work on quitting smoking if you do. So smoking has no health benefit and can impact your life. From a cardiovascular standpoint, the average smoker lives 10 years less than a non-smoker. So this is something you want to talk to your healthcare teams about and try to strategize. And if you have any chronic conditions, such as the ones that we've brought up, like high blood pressure, diabetes, really work with your physician to try to keep them under tight control.
That's fantastic. I always tell men that, if there's 3 numbers you should really try to commit to memory. It's really your cholesterol, sugar, and blood pressure. Like you mentioned, these are absolute risk factors for heart disease. I like how he touched on going over the risk formula with your patients. We use something called ASCVD, which stands for atherosclerotic cardiovascular disease. This is a risk score. It's a national guideline by the American College of Cardiology. And essentially, this calculates your 10-year risk of having a cardiovascular problem, such as a heart attack or a stroke. And so what goes into this formula is exactly what Dr. Okoto is talking about: your age, gender, race, cholesterol, blood pressure, blood sugar, and smoking status. You put all that information into the formula, and it spits out the chance of having an event in the next 10 years. It's pretty remarkable. And so based off of those percentages, then we can customized treatment medically and with overarching lifestyle changes. I like your breakdown of diet and exercise because there's so many benefits to that. One thing I always tell my patients is when you're starting an exercise routine is just to have well-designed goals. And that means goals that are concrete enough to measure so you can hold yourself accountable. I was just telling a patient the other day, just saying I want to walk more may not be as effective as saying I want to achieve 10,000 steps per day. It's specific, it's measurable. Then all you do is reverse engineer it and break your big goal into a smaller goal. So for example, you can say, well, maybe I'll start with 5,000 steps per day and then increase 1,000 steps each week till I get to my goal. So again, specific and measurable. And I always tell my patients, a good balanced fitness routine should always incorporate endurance, strength, and flexibility. With that said, Dr. Winston, we know there are health disparities between races and ethnicities. Are there any health concerns that are specific to Black men that we should know about?
Probably the first one that comes to mind is prostate cancer. While it is the most common cancer that men will experience outside of skin cancer, Black men tend to experience it at a higher rate than other groups. And additionally, and sadly, when Black men do get prostate cancer, they tend to die from it more often than other groups. And there are a lot of different reasons for that. Some of those are societal reasons in terms of lack of access, institutional racism, and other components are genetic, that Black men, when they do present, tend to present with a more aggressive form of cancer. And because of that, we generally recommend for those of African American descent to start their screening of prostate cancer at the age of 45, and even sooner for those who have a first degree relative, such as a father or a brother with a history of prostate cancer presenting early.
That's great. And one thing I really appreciate about Kaiser Permanente is our robust approach to lowering the quality gap between demographics and race, as you mentioned, being one of them, and utilizing our platforms like telemedicine and home monitoring of blood pressure cuffs and glucometers, because hypertension and diabetes is incredibly important in the Black population. And so getting all this information at the convenience of their home really helps to improve a lot of our access to care. So I'm glad we're talking about access. Now, you had talked about prostate cancer. So the number 2 leading cause of death is cancer, and 1 in 6 men will have prostate cancer. And so let's talk a little bit about prostate. I know, Dr. Lee, in your practice, you see a lot of these cases. can you just break it down? What is the prostate? Let's start there and tell us what it does.
Yeah, so the prostate is a very interesting organ. It's actually a sex organ, and its main purpose is to produce some of the seminal fluid. It produces about 20 to 30% of semen. And the purpose is it contains some enzymes, some things to help break down the semen to help facilitate the sperm traveling up the cervix and into the uterus to eventually fertilize the egg. So that's the primary purpose of the prostate. Now, the prostate doesn't really cause problems during the quote unquote childbearing ages. It's usually when men get older, past the ages of 40, 50, that the prostate causes problems. There's two distinct problems that the prostate causes. And even though they happen in the same organ, and sometimes they can be confused for each other, they're actually separate processes. The first one, Dr. Winston already touched on, is prostate cancer, which is the most common cancer of men. And many men will be diagnosed with it. Prostate cancer is a cancer in that it does have the potential to become malignant and spread and do bad things and kill you. But fortunately, prostate cancer among solid organ cancers is one of the slowest growing cancers. So even though many men will be diagnosed with it, for the vast majority of men, it is not a terminal cancer. And for many men, it actually won't affect them. So being able to parse out which cancers are dangerous is one of the most important things, which we'll get into later. Prostate cancer usually develops on the outside of the prostate, and thusly it doesn't usually cause symptoms. The other problem that the prostate causes is enlarged prostate. Now, this is extremely common and almost ubiquitous for all men, over 45, 50 years of age. Prostate enlargement, also known as BPH or benign prostatic hyperplasia, is part of the name, a benign process. And it's just simple enlargement of the prostate. Now, the prostate can enlarge outwards, which doesn't really cause a problem. But the problem is when the prostate enlarges inwards, the location is that it's right under the bladder and it envelops the urethra. So as you can imagine, when it grows inwards, it can pinch the urethra. And thus the urethral channel becomes more narrow. And that's part of the problems that enlarged prostate causes, is the urinary symptoms.
And Dr. Lee, what are some of the signs and symptoms of an enlarged prostate?
So the common urinary symptoms that people complain of can be weak stream, can be urinary intermittency or hesitancy, difficulty initiating stream, or even painful urination. You can also have frequency, urgency, needing to run to get to the bathroom, sometimes not making it in time. Also getting up multiple times at night. These can all be manifestations.
Okay. And I know you talked about prostate cancer. How do we diagnose something like that? How do I know if I have prostate cancer?
Yeah, it's a great question. So since prostate cancer commonly grows on the outside of the prostate and not on the inside, where you typically wouldn't have symptoms until it's very late, the best ways to diagnose prostate cancer is through screening. And the ways to screen for prostate cancer is through a PSA test, which is just a simple blood test, as well as a digital rectal exam. And the American Urologic Association recommends routine screening from ages 55 to 70, okay, with an annual PSA and digital rectal exam, or earlier if there are risk factors, like Dr. Winston mentioned, with either a strong family history or African American descent.
Great. And as far as treatment goes, what sort of direction do you take it with your patients?
Yeah, so the usual way it goes, if there's an abnormal digital rectal exam or if there's an elevated PSA value, with the PSA, we usually like to repeat it because sometimes there can be fluctuations that cause an elevated PSA. So we never make any rash determinations of just one value usually. The diagnostic paradigm is a prostate biopsy. Some urologists may do an MRI before the prostate biopsy. But once the diagnosis is confirmed on the prostate biopsy, we know the prostate cancer. It really depends on the type of prostate cancer. There are some prostate cancers, which are actually the majority of prostate cancers, which we classify as low risk. And these low risk cancers commonly can be watched through a protocol called active surveillance, where we understand that This is very low risk, very indolent, and it will take many, many years for it to turn into something bad and grow. So for these patients, we can just survey them with routine PSA checks, repeat MRIs, repeat biopsies. And the purpose being that once the cancer moves on to be something more aggressive, we can pull the trigger and treat at that time. The other primary treatments for localized prostate cancer are either surgery or radiation. And the biggest things to note is that both surgery and radiation are equivalent, and it's an individualized treatment choice for which is best for which patient.
That sounds great. It's great information. So it sounds like our patients need to be aware of the signs and symptoms, and then also have that discussion, which it sounds like can happen with the primary care doctor as well, whether those are signs and symptoms that we need to investigate further with the prostate exam or the blood test for a PSA. Dr. Winston, anything else you want to add to the prostate?
Sure. So for a lot of patients when they come to us, when they begin to have symptoms, for a lot of guys, the big question is the C word, like, is this cancer? As Dr. Lee pointed out, for most, the overwhelming majority of prostate cancers will present on the outside of the prostate and not really have symptoms. So most of the time when they come in with symptoms, it really is BPH. And we always tell patients that BPH is like a very personal condition, meaning that you have some guys who will take 5 minutes to empty their bladders, but it doesn't bother them. And you have guys where if anything is different in their urination or there's one drip, they're ready to get surgery. So we always try to counsel patients that BPH and LUTS are very personal conditions, and depending on how bad it's bothering you. We always like to, even though we're surgeons, as urologists, we do like to start to be as conservative as possible. So that's first, if someone's coming in with complaints of an enlarged prostate, we kind of want to ask questions and figure out if it's bothering you, how's it bothering you, and what factors, either in your lifestyle, such as your diet or activity level, is causing it. So for example, if a guy comes in and say, I'm getting up a lot at night, we usually will ask, well, what are you drinking at night? Are you drinking a lot of fluids? Are you drinking a lot of alcohol? Those are factors that can cause you to get up more at night than you like. So after those questions, we kind of try to do some lifestyle adjustment to see if that makes a difference. If the symptoms are not receptive to those lifestyle changes, then there's medications that we can give that can kind of help relax the prostate. Unfortunately, all the medications that we give are band-aids, meaning that it doesn't solve the problem. It only becomes a temporary measure to kind of relieve those symptoms. For a lot of patients, they're just happy with that, with those medications. For others, they may want something more definitive, or they're not responsive to the medications. And at that point, we can offer a variety of surgeries that procedures that we can do. Thankfully, in the last really 10 years, we've had an increase of office-based procedures that are really minimally invasive, that can be done safely in the office, that patients can do comfortably awake. And those are generally for the most mild symptoms. Other patients with symptoms are a little bit more moderate may require something a little bit more involved that can be done in one of our outstanding ambulatory surgical centers. And then for the small minority of patients whose symptoms are very severe, meaning that they can't urinate at all, or they're having a lot of other problems, we may need to do something more involved, such as removing a lot of the prostate. But as you can see, we have a wide range of options that we can offer here at Permanente Medicine for patients, no matter where they're coming with their prostate symptoms.
Fantastic. So it sounds like, from what I'm hearing, it's really a individualized, almost a customized approach on what works best for our patients. So it's good to know that we have a cadre of strategies to help improve BPH for our patients. Very good. So let's change gears a little bit. Let's talk about sex, you guys. What are some of the most common concerns that you have seen related to sexual problems? Dr. Winston, I'll start with yourself.
So I would say that this is, and I think Dr. Lee probably can attest to this, that you will have these patients come in for a kidney stone or blood in the urine, and you're asking them about that problem, and then right at you asked anything else you want to talk about, and patients will say one last thing, and that one last thing is usually about this problem. ED affects so many men, and it's probably in the top 3 of like embarrassing problems that people don't want to talk about. But fortunately, when it comes to us at Permanente Medicine, we have a lot of experience, a lot of options to help guys with erectile dysfunction. Similar to enlarged prostates, ED is a very personal condition. Everyone has their own definition of ED. For some guys, if they're having difficulty initiating, that's a problem. Some guys are finish too soon, and sometimes it's all the above. And wherever the patients come in, where we take the time, we listen to them, we're compassionate, we're confidential, but also we make sure that there's no other problems going on. For a lot of guys with ED, it could be a sign of another medical problem, such as high blood pressure, diabetes. Those are probably 2 of the most common reasons why some guys will begin to have ED. Another factor is actual stress, particularly during this pandemic. Stress has really impacted so many areas of our lives. And for a lot of men, one of the first areas to be affected is their sexual health. So we kind of, when someone comes in, we talk to them about their history. We do a physical, and we also like to do some basic blood work to kind of see what else is going on. Sometimes it involves us referring them back to their primary care doctor for some support for their other medical conditions. And then we offer, some medication to kind of help. And a lot of guys are responsive to medications. Sometimes if medications are enough, there are some surgeries that can be done to let them have their sexual life back. But we have a wider range of options that we can offer at Permanente Medicine, and similar to what for BPH, we don't use cookbook medicine. We really meet the patient where they're at and provide the best care for them.
Yeah, one thing I'd like to add on is that, erectile dysfunction really is a multi-system issue. The physiology is extremely complex. It depends on so many things for the erections to work. Obviously psychologically, the attraction has to be there. Hormonally, there has to be intact testosterone levels. The nerves have to make it down to stimulate the erection, and potentially most importantly, the blood flow has to be there to obtain the erection and to maintain the erection. So a lot of the things that we're talking about today in terms of general cardiovascular health and health maintenance, all of those are incredibly important for helping maintain those erections. And, as urologists, sometimes we like to say that, the penis is a window to the heart. And if the erections don't work because the blood flow is poor to the penis, the blood flow is poor everywhere else. And that's another one of the great benefits of Permanente Medicine with our integrated health system, that we can see all of our medical records and we can completely understand the patient picture as soon as we evaluate you. And we can understand potentially which of all those systems is going wrong and address that individually.
Great. That's really good insight. I never thought of ED as being as just a symptom of something greater that could be potentially going on. And Dr. Winston, you had touched on, stress as a potential cause of this, like mental issues. That is incredibly important right now, right? It's at the forefront, especially navigating the pandemic, has really brought to light prioritizing mental health again, and also just developing healthy stress coping mechanisms. We've seen increases in alcohol and tobacco use, but also upticks in drug use. I will say for alcohol specifically, I do find myself counseling patients more so than I did before, especially with men, knowing what their limits should look like, right? And so for men, it should be 2 drinks a day. And a drink is categorized as either a 12-ounce beer, a 5-ounce wine, or 1.5 ounce of hard liquor, about 80 proof liquor there. But I think, to your point, Dr. Winston's, was making sure this is not a taboo topic for our male patients. And so seeking help should also not be a taboo topic. especially when things are getting out of control. And so it's really important to know when we are struggling with depression, when we're struggling with anxiety, know what that looks like. If you're feeling down, hopeless, your appetite's low, you're having sleep issues, or guilt with the way you're feeling, I think that's a time to reach out to us, because we have the resources to help you. If you are finding yourself just difficulty just coping with stressors and having to use alcohol or anything along those lines to cope with things, we have resources to help you sort of cut back and find healthier ways to manage it. And so I really encourage everyone listening in to reach out to your primary care doctor and to your behavioral health team. Now, I know we're getting close to the end here, and I just want to check the chat to see if there's any questions coming in. And while the questions may come in, I do want to offer just some additional thoughts that maybe we hadn't touched on. So maybe I can start with you, Dr. Okoto. Any other topics or thoughts that you had that you feel we should talk about?
Yeah, I think men should just generally stay engaged. I think historically we've always been sort of brought up to be stoic and not really discuss the things that affect us and impact us. But I always try to tell my male patients, don't forget, a lot of people count on you, right? Your family, your friends, your colleagues, and you want to be there for them. So one of the really important ways to really be supportive of your friends and family and other support systems is just stay engaged with your healthcare teams, because we do have so much flexibility now with digital screening and monitoring, and being able to reach out to your physician by secure messaging and things like that. There's just a lot of opportunity there. We don't want you to have all of these things become barriers to you. We all have to work and commute and do all these other things in our lives. But there's a lot of flexibility to engage with your healthcare teams, and it's the most courageous thing you can do as a man. So it's the most manly thing, I think, is to make sure that you're on top of your health.
That's fantastic. Any closing thoughts from yourself, Dr. Lee?
No, I just want to echo what Dr. Okoto says. I think by the time a lot of our patients come to us, it's really, the beyond when they should have come. And a lot of these things, if we address earlier, we can actually reverse. So I do encourage, even the things that you would normally brush off because you want to be manly and, you don't think it's a big deal, that you should come out and seek help.
Absolutely. Absolutely. And Dr. Winston, any other thoughts that you may have?
Yeah, just look, we get it. We're all dudes up here. We know how it is. You want to, these problems come up, you end up Googling it by yourself at night. You get worried about things. Just talk to someone. And even if you don't want to go to the doctor at first, talk to one of your boys, talk to someone you trust to just begin the conversation. Ask them who they're seeing, and just find a healthcare provider that you trust. I think it's so important to make that connection with someone that's going to care about you and that you're going to feel comfortable talking about these very sensitive subjects too. So I'll start there, and then you let that person become your cheerleader.
Absolutely. It's all about creating a comfortable environment and advocating for yourself and the folks that are in your lives. So fantastic. I know this conversation was great. Some really good topics, and I know it's recorded. So I encourage everyone that's listening in to reshare and tag their family and friends who may benefit from listening to this. I really want to thank my awesome colleagues, Dr. Lee, Dr. Okoto, and Dr. Winston, for your wisdom and expert advice today. Really a great discussion. And I thank everyone for listening in as well. I hope you all have a great day. Thank you.